So welcome everybody to this webinar, a synthesis of the latest WHO and UN drinking water reports for government decision making. Yeah, that's okay. So welcome once again, bienvenidos, bienvenue to this webinar, a synthesis of the latest WHO and UN drinking water reports for government decision makers. Please introduce yourself in the chat for the moment. Thank you. So I have people joining from Calgary, Alberta, from Arto from Finland, from people from France, from Boston, from India, Cameroon, Rwanda. So thanks everyone for joining us today. Good afternoon, good evening, wherever you're joining from. There's great momentum behind the HWTS community, exemplified by the high number of registrants for this webinar. We have 585 people registered from 92 countries and territories. Next slide, please. So we have simultaneous translation for this webinar into French and Spanish live translations. Next slide, please. So if you go to step one, click on the interpretation button at the bottom of your screen. Step two, choose the language if you would like French or Spanish. And then step three, click on the mute the original audio. So these are you should see at the bottom of your screen this bar. If you don't see the translation button, then click on the three dots and then it should pop up from that. So I just give you a second for people to choose their right audio. Next slide, please. So also for the questions and answers, we have a Q&A box that you should also find at the bottom of your screen. So please, if you have specific questions for some of the presenters, please put your questions in the Q&A box, and then when we get to that section, it'll be easier for us to manage that section. So thank you very much. Just to note that all microphones will be muted during this webinar due to the high number of registrants. Next slide, please. So once again, welcome from the CAWST team. So the team comprises Sunil, who is a senior manager with CAWST, Christy Parker, learning and measurement advisor, Toby Gould, senior WASH advisor, Curtis, who's a former executive and now CAWST volunteer, Shauna Curry, president and CEO of CAWST, and me, David Weatherall, a senior WASH advisor with CAWST.
Thank you, David. My name is Shauna Curry. I'm the CEO of CAWST, as he introduced me. We're really delighted to be co-hosting this with the World Health Organization. We've come together because of a number of recent UN reports that have come out last year, the Joint Monitoring Program report, August 2025, and the Global Analysis and Assessment of Sanitation and Drinking Water, which provide us with the global context as of these reports. And alongside these, last year, the World Health Organization produced other supporting resources. They've got many, and a couple that came out last year were the guidelines for drinking water quality for small water supplies and a compendium of drinking water systems and technologies. From CAWST perspective, this was something that was new and really important to be able to share with the world. And in discussions with the World Health Organizations, together we saw it important to share with our collective networks and to help enable governments and others to know what's relevant in order to take action. Next slide. The goal at the end of the day is safe drinking water at the point of consumption. This webinar today is part of a series. In March, CAWST hosted a global webinar to introduce these reports to our network. And then in May, this was delivered in Latin America. In both of these, we had a tremendous response, showed a great deal of interest with people from across globally and in the region of Latin America when we produced that in May. And today we're providing a synthesis for government decision makers. This will continue on into and feed into a discussion that we'll be hosting at Stockholm World Water Week in August. And then in the fall, September to November, we have regional webinars planned for Asia and Africa. And the World Health Organization is looking at dates to present the water quality field test guide and the scheme checklist, which enables and helps governments to assess household water treatment technologies in their countries. Back to you, David.
Thank you, Shauna. So just to run through the agenda for today, we have this introduction followed by a presentation by Millie Adam of CAWST, then a presentation by Rory Moses McEwen of WHO. Then we have 20-minute question and answer session moderated by Toby Gould, 10-minute closing remarks by Shauna, and then we'll do the final closing. So next slide, please. So I'd like to introduce Millie Adam. Millie is a water treatment expert that has trained and provided consulting support to HWTS implementers throughout Southeast Asia, including creating the first learning exchange of biosand filter implementers in Cambodia. At CAWST, Millie has led our fund development teams, communications and global services teams, and is now focused on influencing the wash sector to increase acceptance of HWTS as a mainstream solution. So it's my pleasure to hand over now to Millie. Thank you.
Thanks, David. I'm just going to share my screen here. Can you stop sharing the other slide? Because I'm not getting the same options to share. Thank you. All right, give me 1 second here. It's not coming up like it usually does. Okay. Are you seeing?
It's with
With
notes,
notes.
Millie.
Yeah. It's changed since, sorry, we had this all worked out before and then it's changed. Okay, here we go. Now, are you seeing it properly?
Yes, we are. Thank you,
Okay,
Millie.
thank you. Okay, so to start with the different reports that I'm going to go through, there's 4 key documents, and you can see the colored numbers on the side there. As I go through them, those numbers will appear on my slide so that you can see where the data comes from on the slide that I'm presenting. So the first one, as Shauna mentioned, is the Joint Monitoring Program. This report is by WHO and UNICEF, and it shows us the progress on people gaining access to water, sanitation, and hygiene around the world. The next two and three they use the same data, but they're reports that analyze that in more detail. And sorry, I've lost my screen. 1 second here. And then the fourth one is the GLASS report, which you might be familiar with. So this one is by UN Water, and this one goes through where the JMP looks at progress on water and sanitation. The GLASS report looks at the systems in place um, that we have and the progress on those, that the systems that we need to reach everyone with water and sanitation. Sorry, I think I'm gonna have to stop. Sorry, I apologize. I'm gonna have to stop sharing for a second and reshare. Something's gone on my side.
I will share, Millie.
Well, let me try it one more time.
Okay.
Okay, there we go. Um, Moving on. Apologies for the delay. So I thought we should start by celebrating progress. We're all here because we've been working hard to reach people with water and sanitation. In some cases, for many years, we've been working on this and we have made a lot of progress. So basic water access is at 91% coverage right now. We're on track to reach 94% of people by 2030. Latin America in particular is on track to reach everyone with basic water by 2030. So congratulations to them. And just a reminder that basic water access means the use of an improved source within 30 minutes, including time for queuing. But it's time to turn our attention to what's next in water. How do we get everyone safely managed water? And in that case, we are not on track. Since 2015, 961 million people have gained access to safely managed water, and that means about 74% of people have it. But at the current rate of progress, that means we'll only reach 77% of people by 2030, and that leaves a gap of 2 billion people that don't have safely managed water at their home. And in order to close that gap, we would need to go 8 times faster than we're currently going. And that's a global average. So for the least developed countries, safely managed coverage is at 37% and grew by 4% since 2015. In fragile contexts, there's only 45% coverage, and that grew by 2% by 2015. So the story is the rate of progress isn't fast enough to reach everyone by the end of the SDG time period. So who is on track to reach everyone with safe drinking water? If we look a little bit more closely, there's 31 high-income countries who have achieved universal coverage of safe water and 10 others that are on track to do so. There's only one upper middle income country that's on track, and that's Turkmenistan. Congratulations to them. But this means that no entire region is on track. And there are many places that need significant change to accelerate progress. Amongst these areas, the sub-Saharan Africa stands out with the most needs and the biggest gap. So a reminder of what is safely managed water. This is the definition from the Sustainable Development Goals. Basic water, it is the outside circle that you see there. And so an improved source within 30 minutes, and then 3 more criteria. It needs to be available when needed, accessible on premises, and free from contamination. And it also needs to be at the point of use. So we'll talk about that more as we go through the reports, what that looks like. So on this first one, we talked about a basic service already. In this map, you can see dark blue means high coverage and yellow is low coverage. So there's 17 more countries on track to achieve universal coverage. And the progress has been very good on that measure. On the next criteria, available, despite a decrease in all regions of people using surface water, unimproved sources were usually more reliable than piped on-premises services, and public taps were less reliable than piped on-premises. On that next criteria, there's still a gap of people that don't have a source that's accessible on premises, and understandably, a large portion of those people live in rural areas. And then in the third criteria, across almost all countries and different types of water systems, water is more likely to be free from contamination at the point of collection than at the point of use. And so this is something that we're going to talk about in more detail. And I just wanted to note that all 3 criteria are more likely to be met in urban areas, but they're changing faster in rural areas. So we've almost achieved that basic service goal. There's work to do on available and accessible criteria, but the biggest current challenge is water quality. So the main reason why we're not reaching the goal of safely managed water is because water is not free from contamination, particularly at the point of use. So this is a lot, this graph, so I'm going to just take a minute to explain what you're seeing here. The left column shows the quality of water at the point of collection, and the right column shows it at the point of use. Orange represents very high levels of contamination, where blue is low. And the length of each colored bar shows the proportion of the population that has that quality of water. And this is organized by country groups. So at the top, you can see low-income countries, and then below that, lower middle-income countries. So not only from this graph, you can see that large proportions of the populations in these countries are exposed to very high levels of E. coli, so contaminated drinking water. But looking closely at any of the lines, you can see that in most cases, the water quality at the point of use is worse than the water quality at the point of collection. So to give an example, Sierra Leone at the very top, 10% of people have good quality water at the point of collection, and that drops to 3% at the point of use. Another example at the bottom, Côte d'Ivoire, 46% of people have good quality water at the point of collection, and only 21% of people have it at the point of use. So I'm going to move on to the next one, which is a bunch of more countries. same kind of graph, but here we have the first section continuing lower middle income countries and upper middle income countries and high income countries at the bottom. So in this slide, there's a couple where there's just gray and blue. That just means that in that country, the kind of water quality testing they did couldn't tell them the number of E. coli in the sample. It was just a binary answer, contaminated or not contaminated. So there's just not quite as much detail there. And there are a few exceptions to this trend. One is Vietnam, which I've highlighted here. On the left-hand side, you can see 57% of people have good quality drinking water at the point of collection. And on the right-hand side, 60% have it at the point of use. I've worked in Vietnam, and I can tell you that it's a place where it's common practice to boil water before drinking it. And that's where most of the exceptions are. The other exceptions are Nauru and Tuvalu. So Tuvalu is at the top here, going from 9% to 16%. And Nauru is down here, going from 20% to 28%. In those countries, more than half of the population reported boiling water before use. Even then, if you've got half the people boiling their water before use, you still don't have half of the people with clean drinking water at the point of use. So there's still a challenge to be addressed here. Okay, moving on now to one of the papers that I talked about that looks at that JMP data in more detail. Two of the papers, I should say. From that, we see that accessible and available sources are not more likely to be free from E. coli contamination. This is a bit of a surprise because we would expect that if people don't have to transport and store their water because it's accessible at their household and available when they need it, that there would be less opportunities for that water to be contaminated before it's consumed. But unfortunately, that's not the case. We don't know why that is. There wasn't enough detail in this data to find that out. What we do know is that recontamination is happening in all kinds of different water systems. So I've shown a hand pump here, but it's not just for hand pumps that this is a problem. It's across all different kinds of water systems in many different countries. So it's something we should be aware of. The other thing we should be aware of is that people are storing their water in their households prior to use. This is a very, very common practice, again, in a range of systems. So even including when they have a pipe system, they may be storing water in their households, for example, if that system is not reliable and always available. So this is something we should be planning for in things like water safety plans, because this increases the risk of recontamination. The most common, when we did this webinar in March, as Shauna mentioned, the most common question we had was, what are the risk factors for recontamination? So this data basically just said that the risks vary widely between countries. But I did go and read a systematic review. It's Wright et al. From 2004 that was specifically on contamination of water between the source and the point of use. And there it said two things. One was that the proportion of households using a closed storage container was the one thing that explained the variation in contamination between different studies. So a closed storage container definitely is an important practice to prevent recontamination. And the other thing that it showed was that contamination after collection was higher when the average bacteria count in the source water was low. So basically, if people had a good quality source, it was more likely to be recontaminated. And that one's a little bit confusing again. Oops, sorry. We don't know why that is. My guess is that it's a behavior thing and that it might be that people who know their water source is safe are less likely to treat it, less likely to boil it, for example, and less careful about handling it in the household. but that's just my guess. That is not from the studies. So moving on to the CAWST report, as I mentioned, this report looks more at what systems do we have in place in the water and sanitation sector to enable us to reach everyone. So again, there's a lot going on this slide, so I'll just take a minute to explain. The dark blue or almost black there is talking about whether countries have policies and plans in place to reach these vulnerable populations. The medium blue is about progress, whether they're tracking progress to meet those populations. And the light blue is whether they have specific measures to make sure that financing is directed to those populations. So if you look at the left-hand side, they've identified different vulnerable populations, starting with people living in poverty, people affected by emergencies and disasters, people in remote and hard-to-reach areas, living with disabilities, internally displaced people or refugees, elderly people, indigenous populations, populations in slums or informal settlements, and ethnic or religious minorities. So you can see here that many countries have policies and plans in place to reach these populations. But when you get down to the level of having financial resources directed to those populations, it's not happening as much. So the people with the greatest needs are not getting investments directed towards them. This aligns with what we see in the JNP report, that with current approaches, we are not reaching those most in need. Okay, so in summary, what we see from these documents is that we're not on track to achieve safely managed water. And the main reason for that is because drinking water in the households is not safe. It's not free from contamination. That recontamination is a widespread problem, that we're not reaching the most vulnerable, and that we need a range of solutions to reach everyone. And Rory's going to talk about that a bit more. But that basic water target is a success that we can build on. We need an intermediate step to get health gains sooner, and we need clean water at the point of use, even if it has to be collected and stored by the households. So how is this water getting recontaminated? As I said, this is the most common question we got last time we presented this data. So I'm going to go off of the reports for a minute and to just talk about what this looks like. We saw in the reports that contamination often increases from the source to the point of consumption. And in the one paper, Bain et al. From 2021, they looked at 27 countries. And in those countries, they saw that point of use contamination ranged 19% to 99% higher than the point of collection. So it's not a small increase, it's substantial, something we need to focus more attention on. I think I'm an engineer. For the other engineers on the webinar, we were all trained that these are the components of a water system. You start with a source, you have some form of transportation, then you have treatment plant and storage. And you have these four components happening quite linear in this order, and that is a complete system. So we're working under the assumption that it's linear like this, that steps happen in this order. But in the reality for a lot of people, it's not that simple. So I'll give you a couple examples of that. The first one is a small network community system. Here we have a woman operating a treatment plant. She's working hard to make sure that the water coming out of that treatment plant is good quality, and she's doing a good job of that. But in this, we see three of those steps. There's the treatment plant. There's also a pump there because the source is a groundwater source right there, and there's storage. So there's a tank behind her. So you've got three of those steps happening right here. Then it leaves her treatment plant, and it goes to the transportation step. No, this is not the same system. I'm jumping around the world here, but just giving you some examples of what this can look like. This picture is not what we picture when we say pipe system. Unfortunately, in reality, there are pipe systems that look like this. And so I don't think I have to tell you that the water is unlikely to stay safe from the treatment plant to the point of consumption when the pipes look like this. In the third picture, we have another form of transportation. So this is actually from a community where they do have a pipe system, but the water is only available once per week. So on the other days, we're introducing a different kind of transportation, more storage, and another source. People are buying water from vendors to get them through the days when the pipe system is not available. And in the last picture, this is a picture from an emergency situation, which is different, of course. And yes, the water is piped to a standpipe, but look at all the different containers that people are using to get that water to their home. And how likely is it that that water is going to stay safe by the time it makes it home and is consumed? So this was an example of the places where recontamination can happen in a network system. And I'm going to show you a different example, which is in a non-networked or a household managed water system. So here we have two pictures of different sources. One is an unimproved source, but the second is quite a nice source. Looks like a solar kiosk, probably very good quality water coming out of there. And yet from both sources, the water is going into the same kind of open bucket. From there, it's then transported home. This is where there's an opportunity for contamination, especially in an open bucket like that. And then it's stored in the home. So this is a nice storage container. It has a lid, which is a good thing. But how are people getting water out of this container to use it? That's, again, an opportunity for recontamination. And then in the last step, we see that the water is treated. In some cases, it may be treated for the second time and stored again. And that's quite a good safe storage container, but that's not always the case. So all along the way, you can see that these 4 steps that we thought happen in a specific order are sometimes being mixed around. Sometimes they're happening more than once. Storage especially happens more than once. Treatment sometimes happens more than once. So how do we get to safely managed water in these cases? So I've got 3 different scenarios here. Scenario 1 is a pipe system with centralized treatment. So in order for people with this type of a system to have safely managed water, we need to be providing a tap at every house. We need to ensure that the pumps in the treatment plant work all the time. And we need to eliminate power outages, leaks, and burst pipes. If all 3 of those things aren't happening, then you're not actually in scenario 1. You're in scenario 2. If you don't have a tap at every house, or you're in scenario 3, if it's not working all the time, if it's not reliable, or if there's problems with the distribution system and it's not getting to the household safe. Scenario 2 is a safe, reliable source, but it's not on premises. So in order for these people to have safely managed water at the point of consumption, we need to improve water handling and storage practices to keep that water safe from the point of collection to the point of consumption. And then in scenario 3, with an unsafe or an unreliable source, we look at treating the water locally and again, improving water handling and storage practices. So scenario 2 could be, for example, a hand pump, a protected spring, or a public tap stand. These might be very good quality water, and most of the testing is often done at that source, not at the household. So that's where we're missing information about the quality up until this JMP report. And then scenario 3, an example might be surface water, informal rainwater harvesting, or an unreliable pipe system. Okay, so what opportunities do we have to change this direction and ensure that people are getting good quality water at the point of consumption? One is creating policy and funding environments that integrate non-networked options with national strategy. So it's not one or the other, it's both. And we need a range of options to meet everyone because people are living in very different contexts and not every solution works in every situation. We need to increase surveillance and risk management practices for the purpose of improving water quality, reliability, and sustainability. So thinking about, for example, where we're measuring the water quality. Up until the JMP started doing this, measuring both at the point of collection and the point of consumption, we only knew what the water quality was at the point of collection. So this is valuable information. And then centering households' priorities and criteria in wash intervention. So we tend to approach it from the top diagram, which is the treatment works at the center of the network, thinking of that, and then the pipes extending out to the households. But maybe changing in our minds that that model and thinking of the household as the center. What are their needs? What is their reality? And what changes can we make to get them better services? And then finally, promoting non-network systems, which are proven necessary solutions, particularly where centralized systems cannot yet or may never deliver consistent quality at the point of use. So some examples of this are remote dispersed communities, informal settlements, or unreliable pipe systems. Okay. That's all I've got. I'll stop sharing here.
Great. Thank you so much, Millie. Thanks for highlighting the scale of the challenge and for unpacking the key WHO and UN report for us. That was excellent. Now we'd like to move on to the second speaker. I'd like to introduce Rory Moses McEwen. We've seen, yeah, perfect. Rory is a microbiologist by trade with over 15 years experience in water sanitation, hygiene and health. Since completing his PhD in 2009, he has worked internationally in the water sector, including supporting WHO's Global Drinking Water Quality Program for the past 10 years. Rory has contributed to WHO's catalogue of global guidance with particular focus on risk-based management and monitoring towards more equitable and resilient drinking water systems. So with that, I'd like to hand the floor over to Rory for his presentation. Thank you, Rory.
Thank you so much, David. And I hopefully will get this in one go. Okay, can everyone see the shared PowerPoint there?
Yes.
Perfect. Thank you so much, Sunil, for confirming. So thank you all kindly for the opportunity to speak today. So what I'll be focusing on is what decision makers and practitioners can do to improve drinking water safety with a particular focus on households. So particularly where supplies are decentralized or managed, directly by the users themselves. So I'll be briefly introducing some key WHO recommendations in this area, and then together we can explore some of the practical tools that are available that can help translate these recommendations into action. So in terms of what I'm going to cover, I'll begin with the 2024 WHO guidelines for small water supplies, exploring in particular the guidance focusing on households. Secondly, then I'll outline the guidelines recommendations and implementation actions to risk-based management and monitoring of household water supplies. Next, I'll take a closer look at the household sanitary inspection package, and this represents a practical field-based tool that supports progressive improvement in water quality at the household level. And finally, then I'll introduce the compendium, which is in essence, a practical reference that helps to map drinking water options across the full supply chain. So from the catchment and the source right through to the end user. It also helps compare household treatment and storage solutions that are suited to different contexts. So it'll be building on and unpacking some of the elements that Millie has discussed. So to begin with, many of you, I guess, will be familiar with WHO's seminal publications, so the guidelines for drinking water quality. Now, at the core of these guidelines is the framework for safe drinking water. Now, this is a risk-based framework, and it's built around three core elements. The first are health-based targets. You may be more familiar with these in the form of national drinking water quality standards, and these would typically be set and established by the National Health Authority. Secondly, then, to achieve these health-based targets, risk management is practiced by water suppliers. So we recommend that this is through water safety planning. I'll talk a little bit more about this shortly. And thirdly, then, is independent drinking water quality surveillance and monitoring focused according to priority risks. So these are the three elements of WHO's framework. Now, experience has shown that applying this framework in the context of small water supplies can come with challenges. Now, just to make sure that we are all on the same page and have a common understanding, when we refer to small supplies, this would cover a wide range of both piped and non-piped systems. They can serve, dispersed rural, peri-urban, right through to urban populations. They are typically managed by, say, professional providers such as a water utility or equivalent entity. They can be managed by communities, or they can be managed by the households themselves. Now, our focus today will be on those household managed supplies where responsibility for collecting, treating, and storing the water will often rest directly with the users themselves. Now, these supplies, of course, face some common challenges. There can be gaps with technical and resource capacity. And of course, we well know that regulatory blind spots do exist. And where these blind spots are, then there's also going to be a trickle down and have blind spots for support being provided to support these types of small water supplies. Now, but household managed supplies also present a significant opportunity. So the opportunity is there to strengthen the safety and resilience of small supplies and to close the gap between urban and small water supplies that Millie has discussed earlier in her presentation. Now, to achieve this really requires that explicit consideration in policies and regulations. Okay, there needs to be tailored approaches and supporting tools. And this is what the guidelines for small water supplies aim to provide. So it helps governments and practitioners better navigate those common challenges that we've described and to help progressively and sustainably improve the safety of drinking water delivered through small water supplies, including those that are managed by households. Now, the small supply guidelines are supported by a companion publication, the sanitary inspection packages. Many of you may be familiar already with the concept of SIs. I've mentioned earlier, they're field-based checklists, and they help to identify any actual or potential risk factors that could compromise the safety and reliability of small water supplies. Now, although they're considered quite a simple risk assessment tool, it's also considered to be quite a powerful one. Now, the revised sanitary inspection packages, which also came out in 2024, they align more closely with water safety planning principles, and they better address climate-related threats and also water scarcity issues and equity concerns. So we will talk a lot more about these a little bit later on, but I just wanted to give this initial introduction to the guidelines and sanitary inspection packages and what their aim is. And for the next section now, I'd like to focus specifically on how the guidelines support safer water in household managed contexts. So the guidelines include 6 key recommendations that cover some of the wider conditions that are needed to improve small supplies in line with WHO's framework for safe drinking water that I mentioned earlier. Now, today I'm just going to concentrate on recommendations 4 and 5, and this relates to managing risks within the small water supply and also carrying out drinking water quality surveillance on the basis of risk. So for household managed supplies, our focus today, sanitary inspections can provide a practical way to apply both of these recommendations. So just by way of context, I guess, to these recommendations and to make sure, I guess, we're all singing from the same hymn sheet, it's important that we can all appreciate what a water safety plan is. So for those of you who may be less familiar with the concept or hearing about it for the first time, WSPs are considered a comprehensive approach to identify and manage risks across the whole water supply chain. So from the catchment and the source through to abstraction, treatment, distribution, storage, right through to user level practices at the household. So water safety plans would look beyond testing alone and go beyond water quality monitoring. It does include water quality monitoring, but its main focus is around preventing problems before they affect users. So it's a proactive risk-based approach that includes water quality testing, but moves simply beyond just testing at the end of the water supply system. Now, although it is WHO's recommended, or we could say gold star approach to ensuring the safety and adequacy of water supplies, the small systems guidelines do recognize that in certain settings, including household managed supplies, a full water safety plan may be challenging or it may be considered impractical. So in terms of recommendation 4, which is risk management being practiced by the water supplier, the figure on the left shows that the recommended approach should reflect both the scale and size and complexity of the water supply and also how it's managed. So where larger populations are served by a professional entity, such as a water utility, water safety planning would be the expected approach. So we can see the lighter blue turquoise box or circle there on the top right-hand side. Now, at the other end of the spectrum, where supplies are household managed and capacity and resources are limited, well, then sanitary inspections, provided it's combined with ongoing management, maintenance, and other monitoring actions, would be considered an appropriate minimum in terms of risk management practices. Now, the table on the right here translates this recommendation into practice, and we can see for household managed supplies, the guidelines would recommend carrying out sanitary inspection about 1 to 2 times each year. Now, these efforts should capture seasonal variation. There may need to be additional inspections recommended following, for example, things like extreme weather, disasters, emergencies, or other significant events. But the full details are in our small supply guidelines. So moving on to recommendation 5, which is drinking water quality surveillance monitoring for household managed supplies. And this would typically be done by a drinking water quality surveillance agency. So recommendation 5 of the small supply guidelines sets out those core elements of risk-based surveillance. So this would include assessing risk management practices by the water supplier, but also testing priority water quality parameters. Now, for household managed supplies, a sanitary inspection should accompany each water quality test. So this would be the minimum recommendation in terms of drinking water quality surveillance. So this allows results to be better interpreted against the actual conditions on site, and the follow-up action can then be more targeted. So what is the testing frequency? This is somewhat more nuanced, and I don't have time to get into the full details today. But suffice to say that the testing frequency then, which would influence the sanitary inspection frequency in this case, would vary according to the parameter and the risk it represents to public health. So for example, say for E. coli testing as part of microbiological surveillance, this would often mean there might be an initial household testing done on a rotational basis, and this testing then and sanitary inspection will be followed by periodic or event-triggered testing. Now, there'll be a lot more information on this in Chapter 3 of the guidelines if you are further interested. But just to make the important point that we recognize, and of course the guidelines recognize, that water quality testing is not always feasible, particularly for dispersed household supplies. So in these settings, sanitary inspections can still provide valuable evidence on conditions that can threaten water safety and help to guide corrective progressive action at the household level. So even if water quality testing is not possible for whatever reason, be it resources, capacity, distance to laboratories, a plethora of other reasons, WHO would recommend that a sanitary inspection can still be conducted as a standalone activity. And just to make you aware of a possible future training opportunity, WHO, working with the Global Water Centre, have just released an online facilitated training course that covers these core guidelines recommendations, and it includes capacity building on planning and conducting sanitary inspections, water quality monitoring programs, and using data and results to drive meaningful and progressive action. So further courses are being scheduled all of the time, and the details will be available through the QR code that's provided here. Okay, so having looked at how sanitary inspections can support both risk management and surveillance of household supplies, I'll turn to the tools themselves and explore them in a little bit more depth. So the WHO publication on sanitary inspections, it came out in 2024 as well, so same year as the guidelines, and it includes 13 packages that cover the key stages of a typical small water supply chain. So packages 1 to 7 that you can see on the screen there would address sources of water, both surface water and groundwater, and the intakes. Packages 8 to 12 covered more your piped distribution systems, so water storages, piped networks, and tap stands as well. And it also covers other delivery and supply arrangements such as water carting and drinking water kiosks. So lastly, the all-important user level, we have a dedicated package number 13 on household practices, which I'll delve into now in a little bit more detail. So each package has 3 components. So here we're looking at the package for household practices, but all other 12 SI packages follow the same overall structure. So the first component of each package is the sanitary inspection form itself. It records key household and water use information. This provides, the context for the inspection and supports maintenance of water supply inventory, say at national or subnational levels. So as you can see here, the picture on screen, it combines an illustration that depicts common risk factors with corresponding yes/no questions on the sanitary inspection form. And this helps you to identify risk factors that may be present within that particular context. So together, these will help identify unsafe practices, but importantly, prompt when and where corrective actions may be needed. So it's not just that something is wrong with the system, but the form is also driving you towards what you need to do about it as well. Oops. So the second component is the technical fact sheet. This provides basic technical information to support an inspector or a water supplier to complete the SI form. It includes illustrations that show the good or sanitary condition. So this is the scenario without the identified risk factors. So these two illustrations, both in the sanitary inspection form and the technical fact sheet, can be compared. So you have the unsanitary versus sanitary illustration to help you complete it in the field. And it also explains some of the main household water components and practices that are being assessed. Now, the third component of the package is the management advice sheet. This outlines some of the routine operations and maintenance and also monitoring that's needed to keep households and water safe. Okay, so the management advice sheet provides, a practical basis to develop an operations and maintenance schedule. So it has periodic and as needed tasks to support consistent household water supply and operation, which we know is critical to sustaining safe drinking water over time. Now, the schedule covers practical tasks such as regularly cleaning and covering storage containers, checking taps, treatment equipment, clearing drainage areas, and repairing or replacing damaged components. So you can see there on the top right of the screen, it gives you simple troubleshooting guidance and corrective actions for any risk factors that may be identified during the inspection. So it's worth pointing out that the WHO SI package for households focuses largely on, collection, transport, and storage practices at the household level. But CAWST have some very nice technology-based sanitary inspection materials for specific household water treatment technologies. So I understand for boiling, for filtration as well. And colleagues from CAWST can tell you a little bit more about this during the open session. So just to make you aware that all 13 SI packages are available in PDF and editable formats on the WHO website, so they can be used directly as they're provided, or they can be adapted locally if there is a benefit to undertaking such adaptation. Now, we're also in the process of digitizing these SI tools, both on mWater and Kobo Toolbox, which will help with streamlining data collection. I'm sure many of you are using one or both of these digital platforms and are aware how it can support with collecting data, reporting, analysis, and better help support and drive effective decision making. Okay, I think I still have a couple of minutes in credit. You're all being very generous with your attention, so I'll try not to take advantage of that. I just want to give you a very quick run through one last publication that WHO brought out last year, and this is the compendium. Now, this is a supporting publication to the guidelines for small supplies that I've just mentioned. The guidelines emphasize the need for effective treatment, multiple barriers, and context-appropriate technology choices that suit both the source water and other elements of the local context. So the compendium helps support this by providing practical guidance and information to really help you compare and select appropriate water systems and treatment options, including for household treatment and storage. So what the compendium does, it takes a whole of system view. Okay, it organizes the supply chain into 6 functional groups. You can see them here on screen. So it goes from the source and intake through abstraction, treatment, distribution, and household use. So this helps users to see how the individual technologies really, fit together as part of this complete and overall system, rather than just considering each option in isolation. Now, these 6 groups provide the organizing structure for the compendium, with individual options listed under each stage of the supply chain as color-coded here on screen. Now, you'll be glad to hear we're not going to go through every option here on the screen, of course, but the slide really just is intended to give you that indication of the breadth of technologies that are covered across these 6 groups. And together, these different sheets can help the users compare alternatives and understand how household treatment and storage fit within the wider supply system. So zooming in a little bit on the household water treatment and storage elements, you can see here we have 11 fact sheets in total for the household level options. And this covers safe storage, filtration, heat, chemical treatment, UV, solar disinfection, and the removal of geogenic contaminants such as arsenic and fluoride. So there is a 2-page fact sheet for each of these 11 elements that are presented on screen. And the aim, of course, is not to provide a single solution. I'm sorry to say it's never going to be that easy, but it is really just to help users compare these options against the local water quality challenges, what your available resources are, the management capacity, and other context-specific factors. So this example here just shows the compendium in action and how the functional groups are brought together in a complete supply pathway. This is system template 4, which is one of 9 system templates provided, where in this example, fresh water is collected and transported manually with treatment and safe storage taking place at the household level. So the highlighted boxes are really just showing the range of source, intake, transport, and household options that could be combined depending on the local conditions and risks. So the compendium is structured in 3 parts. So part 1 are the 9 different system templates I've talked about. Part 2 provides the 2-page technical fact sheets for the individual technologies. And I'll just zoom in here for a second. I doubt you're able to read that, but just to give you an idea, this is a fact sheet for ceramic filters at the household level. At the top of the information sheet, there's a quick reference panel, identifies which of the 9 system templates this is suitable for, what management level is needed, the local availability, maturity, and acceptability of the technology. And part 3 of the compendium is more around some of the wider issues for successfully implementing overall. So things like planning, life cycle assessment, risk management, monitoring, climate resilience, long-term sustainability, gender equity, and other cross-cutting issues. So we hope the compendium is a useful resource. There are 3 sort of clear use cases for it. It helps practitioners plan complete water supply systems, thinking more holistically about each of the levels really link up together, and helps compare some of the strengths and limitations of these different options. It promotes context-appropriate, resilient solutions in line with risk-based thinking and, of course, the WHO framework for safe drinking water. And lastly, the compendium can be used to support teaching capacity development across both centralized, decentralized, and household level services. So I am very nearly done. I'll just leave you here with a couple of links to some of the main products that we've talked about. So to summarize as well, the guidelines for small water supplies really set the direction. And we have the sanitary inspection packages and the water safety plan tools for small communities are there to support implementation of recommendations around practical risk management. And we have the compendium, which informs context-appropriate technology and system choices. I've also included a shout out to a non-WHO publication, but this is a version of the compendium specifically for emergency and humanitarian contexts, which may be of interest to some participants today. And the QR code here provides a direct link to the majority of publications here on screen, including the newly available French versions of our small system guidelines and SI packages. Now, I'm truly stretching the friendship, but just to make you aware very briefly with what I promise is my last slide, just some recently published guidance and forthcoming resources. The WHO International Scheme to evaluate household water treatment and technologies. A summary report was published just in May, and this is really marking a shift from how, it's been a case of WHO with subsidized testing, and it's shifting now towards a wider use of performance criteria in regulation, certification, and procurement activities. And there's going to be a practical review checklist for regulators and procurers is being developed, and publication of this will hopefully be late this year around Q4. And lastly, coming soon is a resource developed by WHO, CAWST, and UNICEF. And this is a practical guide to help users select drinking water quality field testing equipment that is suited to their needs and operating context as well. So we're hopeful, and the aim is that this will support more informed decision making on factors such as performance, usability, operating conditions, resource requirements, and we hope this will be with you in late Q3 of this year. Okay, I will leave it there. Thank you so much for your attention.
Thank you so much, Rory, for your great presentation. I really like that both you and Millie highlighted the opportunities for improvement of drinking water quality by focusing on households with the new guidance and tools that are becoming available. So thank you so much once again for the presentation. Now we'd like to move on to the Q&A session, which will be moderated by Toby. So please go ahead, Toby.
Thank you very much, David. We have quite a few questions here, and something like 20-25 minutes to go through these, or perhaps a little bit less. We will answer all the questions either coming back via email and upload the questions and answers linked with the webinar. So there's a couple of questions that Rory has already answered around drinking water quality data for Bangladesh, looking at going to washdata.org for that, and similarly on treated hospital wastewater for irrigation and landscaping. So Rory's suggesting a WHO publication on reuse of by health-based targets for wastewater reuse, and having a risk-based approach. So let's jump into some of these other questions that require further answers. So from Permanent Ngoma, first of all, the latest WHO and UN reports highlight the need for stronger WASH governance systems, yet many urban water policies still measure success primarily through infrastructure and service coverage. How can governments better integrate gendered experiences of care and meaningful citizen participation into drinking water governance so that these become indicators of safe and resilient urban water systems? I'm just wondering, perhaps, yes, I don't know if Rory or possibly Batsy here also from WHO would be able to answer that first of all, and then I might go to Millie after that.
Yeah, it's a big question, and try and avoid a politician's answer as much as possible. But I mean, there is a case certainly with that to, broaden performance indicators. It is, of course, a huge challenge that's been highlighted. I'm very glad to hear it recognized and raised in that way. And it is so often the case that they are the headline items for a lot of this work. But yeah, there is scope to broaden indicators, I guess, move beyond just infrastructure and coverage, to have sort of clear focus and indicators around safety, reliability, affordability, user experience, for all users, considering the different user experiences of water with any given water supply. So I think, yeah, they can be supported, I guess, by building participation into the planning processes as well with all of these users of the system, with service monitoring and other accountability mechanisms as well. So I'm no expert in this area, but that's my 2 cents. I'd be happy for anyone else to jump in as well.
Thank you, Rory. I don't know, Millie, if you want to add anything to that.
No, that was a good answer to a tough question. I think to give them credit, they have taken steps towards that by during in the SDGs, including these other criteria like accessible and available. I think that came from recognizing that just access wasn't actually meeting people's needs at the household. So they've taken steps in that direction. There's more work to be done. And I think the only thing I would add is that that's why we talk about centering the household versus centering the treatment system. So understanding what the criteria of the household are and whether the system that's being provided meets those needs. And that's where you can include things like gender.
Thank you. Batsy, I don't know if you want to add to that, or we've got a reasonably short amount of time. So Batsy, if you want to add to that, please do. Otherwise, we'll move on.
Sure. Thanks for that opportunity, Toby. I think it's a good question. And there's some examples of what is being done in this space. For instance, if we think about the regulatory authority in Kenya, WASREB, has really put in a lot of work into integrating affordability and I think gender issues into some of their regulatory frameworks, particularly when you think about sanitation services. So this is to say that there are examples of where this is happening. And the question is, how do we showcase some of those examples? How do we have more opportunities, more platforms to share such experiences and therefore encourage others to go in the same direction?
Thank you. Thank you very much. So a question now from Enos Malambala. So water quality is often better at the point of collection than at the point of use. Given the potential for deterioration within building plumbing systems and household storage, how can water safety plans be extended or adapted for buildings to ensure water quality is maintained all the way to the consumer's point of use? So Millie, that came from your presentation, first of all. I don't know if you want to answer that.
I can start, but I think maybe Rory or someone could answer better. But I think we do now, water safety plans were originally designed for like utility scale systems, and now there's more guidance on smaller systems and households how to apply that water safety plan. And the intent is that yes, it continues right from the system to the household, that you're thinking about where are the risks all along that pathway and how can we address them. So I know there are resources from the WHO, and CAWST is also developing a workshop on that that should be released in the next few months.
Right, thank you. Rory, water safety plans in buildings.
Yeah, I can only endorse what Millie has said. It's a huge part of water safety planning. It's always been from the catchment to the consumer or end user. It does recognize that, you know, the mandate for, say, a larger water utility may end, say, at the water meter or the point of delivery, but we know from experience, there's a huge scope for recontamination or contamination at the household level. So water safety planning, particularly in small supplies, would always encourage to consider household level risks under the WSP umbrella. Water safety plans can also link to existing initiatives that may be happening in that space and that may be led, say, by other community groups or local health representatives. And we do have some guidance out there. Water safety in buildings is particularly, I'll try and share some links. I'm not a great multitasker, but I'll try and do it before the end of the discussion to that water safety in buildings, which looks particularly at household risks and plumbing. But we also have some resources and templates for water safety plans in certain contexts, including institutional settings such as healthcare facilities. I know there was a question on that earlier, and schools and other places. So I'll pop some links in the chat for that.
Thanks, Rory. Yeah, we'll make sure we publicize those links when we send out the presentation. Everyone will get the presentation and recordings, so we'll do that at the same time. So a question on from Sri Irianti from Indonesia. So Indonesia still classifies refill water, so refill water using reusable containers to take water from treatment and distribution centers. So Indonesia still classifies refill water as an unimproved water source, although 35% of households use it as a primary source of drinking water. So BRIN, the National Research and Innovation Agency, has proposed to the Ministry of Health to include it as an improved source to encourage vendors to comply with the standards. What would you suggest us to do? Again, possibly Rory or Batsy. Is there much in terms of reusable containers?
Yeah, I mean, I can only speak to this quite broadly, and I understand there would be some of the valid risks and concerns that have been raised during Millie's presentation about why this may be considered unimproved. Everything is very context specific, obviously as well. In certain contexts and settings, some of those risks may be well managed. I think Millie had the example of how prevalent boiling is in certain countries and other places. So yeah, I really can't speak to that really beyond, there are those valid concerns and country settings. There may be cases, for that. But again, our challenge, I guess, with the JMP monitoring criteria is that it is global and globally sort of classified and defined. So yeah, I can't speak beyond that, I'm afraid.
Okay, thank you. So yes, a question now from Henk Holstad. You mentioned water safety plans. Do you have an indication how many countries in Africa mention household water treatment and safe storage in water safety plans? I don't know. Again, I'll open that up, but I think maybe Rory, if you any thoughts on that?
Yeah, I can speak globally in terms of countries that have water safety planning. I'm not sure what the exact breakdown is for region by region, but there was a 2017 report by WHO and the International Water Association, where countries, at least, I think it was, let me say, over 90 countries globally, including the African region, had at least one water safety plan in place or an equivalent risk management approach. That doesn't necessarily mean that those 90 plus countries were implementing water safety plans at scale, and how many of those meaningfully covered household level risks would be a very interesting research question. I know from day one, WHO has recommended that the risk-based approach encompasses household level risks. So, but we do see in practice, particularly in larger utility supplies, where once their mandate stops, the risk assessments stop as well. But it's certainly encouraged, as we mentioned earlier, to consider the whole supply, or otherwise, if one barrier fails, particularly the barrier that's at the very end of the system, that there's not much in place to catch any of those hazards that reemerge. So
Thank you. Thank you, Rory.
Toby, if I could come in on that.
Yes, please go ahead, Betsy.
So I think particularly when it comes to household water treatment versus household water treatment and water safety planning, I think we also need to bear in mind who the main stakeholders or institutions that are implicated are. So if you look at a lot of countries across the African region, when you talk about household water treatment, you're typically talking to somebody from the Ministry of Health or somebody from the entity that is responsible for sanitation. But when you talk about water safety planning, you're talking to utilities and ministries of water, or sometimes environment. So that is not to say that there is no policy provision for household water treatment. It could be that within the water sector or the water/environment sector, it is not reflected. It could be reflected elsewhere. So certainly from experience on the household water treatment side, we see more policy reflection of household water treatment from the Ministry of Health, or sometimes the Ministry of Sanitation, whatever it may be called, and not necessarily within water.
Thank you. Thanks, Betsy. We've probably got room for one more question, and from Melvin Moigua. again, a lot of these are pushed towards the WHO side. So how does WHO balance the urgent need to expand water reuse for climate resilience with the potential long-term risks posed by emerging contaminants such as pharmaceuticals, PFAS, so, microplastics, and antimicrobial resistance, especially where routine monitoring is not yet feasible? You've got that question, have you?
Yeah, yes, we do. I'm happy to have a first stab at it, and then I can open it up to my colleagues. But yeah, there's no question, how much of the planet is experiencing water stress and water scarcity at the moment, and it's really driving, I guess, looking at more innovative ways to diversify water sources, both for routine use, but also in emergencies. And water reuse is certainly not a new innovation, but I guess it's uptake in certain regions of the world. It wouldn't be a first port of call for many countries. It's really driven out of a need, and that comes with a different set of risks, as has been mentioned. A colleague touched upon it earlier as well in one of the questions about healthcare waste and what can be in wastewater. So there is WHO guidance out there around potable reuse, so reusing wastewaters for drinking water, and that will of course have the full range of risk-based guidance and treatment options in there to be considered. All of those hazards that have been mentioned, pharmaceutical, personal care products, microplastics. Yeah, all of these things are a longer term risk to health, there is no doubt. And a lot of those risks are still being understood, and there needs to be that watching brief kept on them. As national regulations, I don't want to say catch up, but start to give more attention to these particular parameters. But WHO would always stress that the acute health risks from microbiological contamination are the priority, and particularly in small and rural settings where resources and capacity are particularly constrained. And there are some priority chemicals that are also encouraged to monitor on the basis of risk. So if there's a high risk that they may be there at concentrations that affect public health. But certainly we would encourage priority and resources are focused around microbiological testing, and be it indicator organisms like E. coli or surrogate parameters like free chlorine, turbidity, and pH as well. So yeah, I'm happy to leave it there.
Thanks, Rory. I think at this point we're going to have to stop. We are capturing all your questions, and we will respond to them. Those that are useful to present to everybody, we will provide that back with the recording of the presentation and the presentation slides as well. So thank you very much, Batsy Majuro, Rory Moses McCown, and Millie Adam for your responses to the questions. Thank you. I'll hand back to David.
Thank you, Toby, and the panelists for fielding some challenging questions there. And now I'd like to hand over to Shauna for some closing remarks.
Thank you, Rory and Millie, for your informative presentations. Just as a recap, the goal of this series of webinars alongside the WHO is that we have safe drinking water at the point of consumption. And we've got some excellent reports that Millie outlined on the Joint Monitoring Program and the GLAST report that really indicate the need to focus specifically on the water quality at the point of consumption, because there's significant recontamination. And what we see is one of the significant advancements in the reports and supporting documents from the WHO is this compendium, which fills a gap between these global contexts and drawing upon what we've learned from around the world to put in front of everyone options to be able to navigate this for your local context. And I know that this has been informed by so many people around the world and the realities that people face. These are alongside the guidelines and many other tools and resources, as Rory outlined, the sanitary inspection forms and other guidelines. And as a reminder, the scheme checklist and the field guide test, or the field the water quality field test kits guides. Sorry, I'm getting the name of it wrong, but these will be coming up in future webinars. I know the WHO is looking at dates to be able to release those and provide it, which brings me to some of the comments that I saw, comments and questions is how do we then translate these into practical actions? The WHO has training upcoming, and then I'll get you to flip the slide to the next one. CAWST has several trainings that we have. We provide them both in the online space and in person. We've got training partners around the world to help bridge now you've got the compendium and all these toolkits, and then how do you apply them in your local context? So the blue boxes are around everything that is focused in our training that is specific to water quality at the point of consumption. You can reach out to us anytime. For these, we're focused on the affordable technologies and practices that people can implement in their communities and their homes. Next slide. One of the things that I'd like to showcase here and is really a sense of encouragement and celebration from our standpoint is this global network of people taking action. Every year we do an annual survey, and in 2025 we had over 2,000 clients or organizations that around the world that responded to our training partners and to CAWST, and collectively they reached 47 million people with better water sanitation and our hygiene. And this is people in their homes and their communities taking action to make it better, to improve their lives and the lives of others around them. And so together with the toolkits and the compendium with the WHO and the education training that CAWST provides and other organizations, that we're making great headway. And it really points to the power of one person taking action and improve their lives and lives of others. Next slide. And ultimately, once again, is our goal together with all of you and with the World Health Organization is that people have safe drinking water at the point of consumption. And I want to thank everyone for joining us today, for your questions and comments. And I will now turn it back to David.
Thank you, Shauna. Yeah, so we have many different ways that we can stay connected in the future. So we have the CAWST.training website where you can find courses on HWTS, biosand filters, chlorination, rainwater harvesting, alongside sanitation and hygiene related courses. So, and also there on this website, there'll be postings for upcoming in-person and online trainings which you can join. Secondly, we have a WASH Resources website, washresources.cost.org, with hundreds of resources, including training manuals, technical briefs, fact sheets, posters, games, and videos, which are freely available to access and use. We have 5 core languages which these resources are available in: English, Spanish, French, Portuguese, and Arabic. Plus, if you register on the WASH Resources website, you can access an AI tool for many other global languages which are available by that tool. And then finally, on this slide, we have, if you have any technical questions or learning related issues, you can contact support@cawst.org. Next slide, please. And if you're looking for more, we have a blog on the CAWST.org website with related content, including a one-pager with next steps that you could take, and also a white paper, what is the evidence that HWTS is effective, which references the key studies considering diarrhea reduction, improvements to water quality, and reduction in stunting. And then importantly, we have two more regional webinars which are coming up this year. One for Asia in September and another one for Africa in November. So we'll be very happy if you're able to join those regional webinars. Thank you to Procter & Gamble for their generous support of the HWTS network and this webinar. It's very much appreciated. And finally, thank you to all of you for taking the time to participate in this webinar. And a special thanks to our speakers today, Millie, Rory, and Shauna. Thanks to Toby for moderating the Q&A and our interpreters and the CAWST team behind the scenes, including global services and the marketing and communications. And we look forward to seeing you at a future event. Thanks for being part of the HWTS community, and goodbye from Calgary.